to another episode of Well-Adjusted Mama. This is a podcast dedicated to educating and empowering women from preconception, pregnancy, birth, and through early motherhood on wellness lifestyle. I'm your host, Dr. Laura Brayton. I'm a maternity pediatric chiropractor, functional medicine practitioner, and mother who has hand-selected experts in natural holistic healthcare specialties to shine light on options and choices during this exciting phase of a woman's life. Today's episode, we talk about how to find and remove the triggers of Graves disease and Hashimoto's, and my special guest is Dr. Eric Osansky. Dr. Eric Osansky brings over 15 years of chiropractic care, functional medicine, and nutrition expertise. After achieving remission from Graves' hyperthyroidism in 2009, he has dedicated his career to empowering others to address thyroid and autoimmune conditions naturally. As the published author of Natural Treatment Solutions for Hyperthyroidism and Graves Disease, Hashimoto's Triggers, and the Hyperthyroid Healing Diet, he shares actionable insights and evidence-based strategies. His podcast, Save My Thyroid, educates listeners on effective holistic approaches to thyroid health. With advanced credentials including a master's degree in human nutrition and functional medicine, certifications as a clinical nutritionist, and certified nutrition specialist, and training in herbal therapy, Dr. Osansky continually expands his knowledge through conferences and specialized courses. Hi, Dr. Eric. Welcome to the show. I'm very excited to have you on today.
Excited to be here. Thank you so much, Dr. Laura.
So I love for you to tell your story. I think it's going to be a really fascinating one, a very inspiring one for people to hear about your thyroid journey.
Yeah, so my background is a chiropractor. For about 7.5 years, had a regular chiropractic practice. And in December of 2007, I was in the process of dieting, detoxifying, and in the process lost a good amount of weight, which at first I initially associated with the dieting and detoxifying. But long story short, I ended up I was walking in a retail store, a Sam's Club, and they had one of those automated blood pressure machines. And I took my blood pressure, which was normal, but my heart rate was around 90 beats per minute, which of course is a little bit high. Next few days, I just manually checked my heart rate on my own. It was anywhere between 90 and 110 beats per minute. And so I knew something was up. Went to a local doctor, diagnosed me with hyperthyroidism, and putting the pieces together, it made sense. The loss was extreme. Forgot how much I lost up until that point, but overall, eventually I lost like a total of 42 pounds and I was 182. So I wasn't trying to lose that much weight like when I was losing weight. So I got down to 140.
Oh, wow. So you were very thin.
Yeah. So I lost a lot of weight, had the voracious appetite, which again, I associated with just the detoxifying, the dieting. I also was exercising intensely, which I'm sure also played a role because I was overtraining, not knowing at the time. And that explained not only some of those symptoms with the elevated resting heart rate, went to an endocrinologist, was diagnosed with Graves disease. And at that point, this was now 2008, and I really didn't have experience with Graves, but I did, as you know, as chiropractors, we have to get our CE credits, and I would always take nutritional courses for my continuing education. And I took a few functional endocrinology seminars. And so they spoke mainly about Hashimoto's, but they did touch upon Graves and they spoke about some natural options. And so when I was diagnosed, I didn't know if they would work, but I'm like, you know what? I'm going to try to take the natural approach, not just take the anti-thyroid medication. Obviously didn't want anything to do with radioactive iodine thyroid surgery, which is commonly recommended to those who have Graves. And so, I started doing things diet-wise, stress management-wise, supplement-wise, and going into 2009, was able to improve my health, get into remission. And that's been over 15 years ago. And since then, I've been working with people not only with Graves, but Hashimoto's as well. And it's been great. So I made the transition from just regular chiropractic to more functional medicine practitioner and just really focusing, having a thyroid-based practice.
It's so interesting how when we have like our own personal life experiences, how it really drives us and how our professional life, right? Like if you had never had that diagnosis, you probably wouldn't be doing this type of work now, right? That was your inspiration. And like, you'll see that like if there's a family member who's sick and then as practitioners, we learn all about how to help that person, ourselves or other family members. And then it's like, you have all that knowledge. Why would you not use it with your practice members and the people in your community that could benefit?
Exactly. Yeah. No, I couldn't agree more.
It makes a lot of sense. So I'm always interested, when I hear stories about somebody who it sounds like overall you had a healthy lifestyle and you still develop this autoimmune disease, Graves. So do you have any correlation of like what happened that even triggered that initial onset?
I mean, I'm sure stress was a factor, even though I was in denial at the time. Not that I denied that I was under stress, but I thought I did a good job of managing the stress. But I mentioned it wasn't just emotional stressors, but I also mentioned I was overtraining, and that was taking place for a while, just exercising, I think, too much.
Physical stressors, yeah.
Exactly. So I think a combination of the physical and emotional stressors was at least a contributing trigger. Was it the main trigger? I don't know. That's the thing about autoimmune conditions. Usually there are multiple factors. And again, my diet was pretty good. But honestly, it wasn't perfect at the time. It wasn't like I was 100% gluten-free, which could affect the permeability of the gut. Could have also been a factor, maybe in combination with the stress. Obviously, we all have increased toxic burdens in this day and age, which I think the stress was the main factor, but I'm sure there are other things also that played a role.
Yeah. So it's all interesting. So from what I'm hearing, once you got your diagnosis, because of your philosophy as a chiropractor about innate intelligence, the body's ability to heal itself when you give it what it needs, it sounds like you never went on medication and you certainly chose to not do radiation and surgery. And you were like, I have a little information about alternatives. So did you work with a practitioner as well? Or you just started whatever you had learned in these seminars, you started to practice on yourself?
Initially, I did get some guidance from a natural healthcare practitioner, but what I found out is really nobody had experience with Graves. So I was kind of on my own as far as just trying to, so I did get some help, but I also did a lot of things on my own just because, again, there wasn't someone like me out there at the time. So yeah, it was, I guess you could say, a combination of both. But obviously, as you know, when it comes to diet and lifestyle, really it's up to us. Like there's guidance we could get from others. And same thing when I work with someone, it's great to help someone, but really it's up to the person to change their diet, change their lifestyle. When it comes to testing, obviously I give guidance with the testing. And when I dealt with Graves, I guess, again, it was a combination of advice that I got from a practitioner, but also some things I did on my own as well, as far as like adrenal testing, for example, and certain blood tests. So yeah, a lot of it. I mean, like I said, I wish at the time there were the resources that were available now. Now there's a lot more out there, but at that time, even the practitioners didn't have a whole lot of knowledge. There wasn't as many functional medicine practitioners back then. This was almost 16 years ago than there was right now.
That's such a good point. I mean, functional medicine is becoming so much more well-known for patients as well as people who are interested in practicing it. And I'm wrapping up my IFM training right now, and it's fascinating work, right? And it's so empowering. But at the end of the day, it does boil down to the patient willing to do the work, willing to make the changes that are recommended. A practitioner cannot heal your body. You have to do the work to help it heal and give it what it needs, right? So, but that is, at least I think that empowerment piece is so important. That's missing typically from allopathic medicine is, okay, there is a diagnosis here. And, an autoimmune disease diagnosis can be very overwhelming for an individual, right? But it's recognizing that this is not something you have to live with for the rest of your life, which is something that we're not really conditioned to hear, right? And there are alternatives to medication and surgery to not only not be symptomatic, but to also just, like you said, go into remission. Like this is no longer a part of your life, right? I mean,
yeah. Some people don't like when I use the word remission because I do feel like I'm cured, but I know with Graves as well as Hashimoto's, there is a genetic component. So there's always a chance I could relapse. Hopefully I won't, but
if your lifestyle changed, then it would be probable that you would relapse, right? So it's really recognizing that the epigenetic components that go into whether you turn on the genes or not.
Exactly. Yeah. So, but yeah, so it's been, again, 15 plus years. I feel great. I mean, I've had some scares along the way. I did have diagnosed with chronic Lyme in 2018. Still, even that wasn't as bad as some other people. I had some neurological symptoms, but again, looking back, definitely wasn't comparable to a lot of people where it's debilitating and the fatigue and the pain. I didn't experience any of that. But
do you think Lyme contributed to the Graves?
Well, this was 10 years after. So I was diagnosed with Graves again in 2008, chronic Lyme in 2018. Now,
chronic though, how long did you have it, right?
It's possible that I had it in my system when I had Graves and I just didn't notice. And I mean, I guess there's that possibility that, so it's hard, if not impossible to tell in my situation if that was a trigger. But either way, it's just trying to live in harmony, like with these microorganisms like Lyme, Epstein-Barr, which could be a factor in certain thyroid and autoimmune thyroid conditions. We can't completely avoid them. So just try to optimize our immune system. And that's the same thing as far as staying in remission, maintaining my health, just realizing, again, Graves as well as Hashimoto's, these are more immune system conditions than thyroid conditions. So we want to do everything we can to improve our immune system health, as well as maintain our immune system health.
That makes perfect sense. So let's talk about, for somebody who's maybe not familiar with Graves or Hashimoto's, if you could talk about some symptoms associated with those two autoimmune conditions. I would love to start with that. Yeah.
Sure. Well, Hashimoto's is definitely more common. So what Hashimoto's is more commonly associated with low thyroid. You have the immune system attacking, damaging the thyroid gland, which over time can lead to subclinically low thyroid, which means it might be within the lab range, but on the lower side. And sometimes you'll get overtly low, where it's below the reference range. So in the thyroid hormones, we'll talk about T3, T4. And when they're low, you might have symptoms such as fatigue, weight gain, brain fog, constipation, coldness. So it essentially is slowing down everything. I mean, it's associated with the metabolism. And with Graves, it's the opposite. You have the elevation of thyroid hormones, the elevation of T4 and T3. So I mentioned how I had an elevated resting heart rate and I had heart palpitations. I had tremors. Well, I didn't have a lot of anxiety, but anxiety is common with Graves. Sleep problems, those are also common. I mentioned constipation with Hashimoto's, loose stools, diarrhea, common with Graves. I mean, hair loss is common, actually, with both Hashimoto's and Graves. It seems to be more severe in my Graves patients compared to those with Hashimoto's as far as the hair loss. So yeah, those are, and thyroid eye disease, I should mention, which is a condition where the immune system attacks the tissues of the eyes, and probably present about 40 to 50% of those with Graves. Many cases it's mild, sometimes not even noticeable unless if you go to an eye specialist. But sometimes the symptoms could be severe, and you could have like severe eye bulging, you could have swelling, double vision. So yeah, those are some of the different signs and symptoms that differentiate Graves from Hashimoto's.
Okay. And I think what's challenging too sometimes for people, like let's say a new mom is having some of those Hashimoto's symptoms that you're mentioning, she gets her blood work done and it's like you mentioned, subclinical, right? So her and maybe they only check TSH and like, so it's like, oh, everything looks fine, right? Everything's in normal range. You're just recovering from giving birth, right? Kind of blowing it off. So that's where working with like a functional medicine practitioner who's going to run a complete thyroid panel, right? You're looking for those thyroid antibodies. You're looking for the complete picture of that thyroid health, especially when you're correlating it with those symptoms that speak to a hypothyroid condition.
Yeah, I mean, you're right. Like you mentioned, a new mom that might associate some of the symptoms with just being a new mom. Oh, I'm tired because I'm not getting the sleep I need. And that's also affecting some other symptoms, like maybe I'm experiencing brain fog because of that reason as well.
Carrying extra weight.
Exactly. And then you get the thyroid panel, and you're exactly right. The thyroid might be within the lab range. You might have the TSH on the higher end, which is TSH I didn't mention earlier. That's thyroid stimulating hormone, which is a pituitary hormone that signals to the thyroid gland to make hormone, or in the case of like Graves, to stop it from making hormone. But yeah, you might have a TSH of like 3.5, which most labs would say is normal, but it's not optimal. And same thing, you could look at the thyroid hormones, but the medical doctors, at least most conventional medical doctors, would look at a thyroid panel within those ranges and say, oh, everything looks good. But again, and they many times won't test the antibodies. That's even the case if they diagnose someone with hypothyroidism. Like if TSH is elevated, they might not look at the antibodies because the treatment's the same regardless for whether it's Hashimoto's or just hypothyroidism. And not diagnosed with Hashimoto's, they would recommend thyroid hormone replacements. But again, we're talking about if the thyroid's out of range. If it's not out of range, like we said, the person, they might just go and deal with the symptoms. But as you also mentioned, a functional medicine practitioner will look at the whole picture, not only look at a complete thyroid panel, the antibodies, but also do more comprehensive blood testing, maybe do some functional medicine testing, look at the adrenals, look at the gut, and just maybe, depending on what the person's health history shows, maybe do some testing for mold, or it really depends. It could be a lot of factors where most medical doctors won't dig deep.
Yeah, so that's really fascinating. So, to me, what separates somebody with a hypothyroid versus a Hashimoto's, for example, is what you mentioned, that overreaction of the immune system, right? So what is triggering that? You just gave a couple of examples: mold exposure, certainly the gut gluten connection, right? If there's some inflammatory food particles that are coming through, that's going to overstimulate the immune system. What else could we see also like postpartum with these drastic hormonal shifts can sometimes in some women trigger an autoimmune response, right?
Yeah, we could talk. Yeah, postpartum thyroiditis, pretty common. And the thing about postpartum thyroiditis, some might say, some even practitioners will say, well, that's like a trigger. The birth process is a trigger. But I mean, the truth is that these women had elevated antibodies during pregnancy. So it was almost like not necessarily the trigger, but the straw that broke the camel's back. And why is that the case? I mean, usually there are other factors. You definitely get immune system shifts. You get increase in prolactin, of course, and a prolactin also stimulates the immune system. But again, these are normal. Like it's normal to have prolactin increase. It's normal to have these immune system shifts. But I think it's safe to say that many of these women also have other imbalances, like a leaky gut, for example, which is, as I mentioned earlier, a factor in autoimmunity. Stress certainly could play a role. Like you said, the gluten, other dietary factors could also play a role too. So to me, postpartum thyroiditis, it's it was existing, the autoimmune component was existing prior to giving birth, but then it was a combination of factors, not just the birth process that triggered the autoimmune component, because again, it was triggered already, but as far as it manifesting right afterwards, the woman usually has other imbalances. And one other thing I'll say with that, there is a good amount of research showing that selenium supplementation during pregnancy can also help to prevent or at least minimize the incidence of postpartum thyroiditis. Again, not to say just doing that alone is what someone would want to do. They would, of course, want to try to eat well, eat healthy, try to do their best, getting sufficient sleep, managing their stress. But there are actually a few different research studies showing that supplements with like selenomethionine during pregnancy can potentially at least reduce the incidence of postpartum thyroiditis.
Yeah, that makes a lot of sense. And so I'm thinking about a new mom who's given birth. If she's under supported, that's going to just feel even more stressful of caring for this newborn, potentially recovering from a traumatic birth, and just not having the tribe that all women need after giving birth to help support her in healing physically, emotionally, mentally, spiritually, right? So if that support's missing, then we can see why that overwhelm might show up as an autoimmune diagnosis, right?
Yeah, no, exactly. I mean, you're right. I mean, most women don't have the support that they need, don't have a community. Thankfully, they have shows like yours to, show them that they're not alone and realize that they don't have to be alone and that they can get the support that many just aren't seeking out the support. I mean, that certainly was also the case with my wife. We have 2 daughters, and I can't say she was seeking out support after the birth of each of our daughters. But yeah, that could definitely make a big difference in one's health.
So if a woman is, like, let's say she either has this diagnosis of Hashimoto's or Graves and or suspects she might, how could she work with somebody like yourself to get answers and to get guidance on how, if she's looking for an alternative or natural way to heal her body versus medication and surgery?
Yeah, I mean, and I should also add there is a time and place for medication. I mean, the surgery obviously should be like the last resort. The medication, even though I avoided it, I mean, when someone's thyroid hormones are really low, they might, I mean, you want to address the cause of the problem, but maybe they need to take
temporarily, right? It could be like a bridge.
Exactly. And then when someone has hyperthyroidism, again, that could be serious too. So sometimes they might need to take antithyroid medication such as methimazole, again, on a temporary basis. So as far as working with someone, I mean, just again, you mean as far as the actual process of finding someone, or you mean just?
Yeah, finding someone and what you would do with a patient who's coming to you with this condition?
Yeah, well, I mean, when someone sees me, just like any other practitioner, including I'm sure yourself, we have a comprehensive health history that they'll fill out, including a metabolic assessment, a toxin exposure questionnaire, just really try to dig deep into the history and try to figure out what might be some of the potential triggers, underlying imbalances, or at least give us guidance as far as the testing we need to do to try to find the triggers and underlying imbalances. So that's the first part, is having them complete that history. And then usually we start out with the foundations, having them eat a healthy diet, make sure eating whole, healthy foods. And obviously there's different opinions. Yes, 10 different practitioners will have different opinions. There's no diet that fits everyone perfectly, but we all would agree whole, healthy foods. I mean, I recommend combination of plant-based foods, but also make sure they're getting enough protein, most of my patients eat meat. So just making sure it's grass-fed, grass-finished beef. But anyway, so a healthy diet. Stress, as we discussed a few different times, is important. So just making sure they're aware of the impact stress has on their health, and also educate them on the importance of blocking out time for stress management, working on getting proper sleep. So again, the foundations are important. And also things like reducing their toxic load, using natural cleaners, cosmetics, also very important. And then the testing, just trying to recommend testing to find potential triggers and underlying imbalances. Again, mentioned earlier, like looking at the adrenals to see what adrenal imbalances they have, maybe looking at the gut in some cases to see if they have something like H. pylori or parasites, or we mentioned mold, doing maybe sometimes a mycotoxins test or testing their home for mold, or looking at certain nutrient deficiencies like iron, doing an iron panel, looking at RBC magnesium, vitamin D, commonly deficient, and you need healthy vitamin D levels, not just for healthy bones, but also for healthy immune system. So yeah, just again, trying to really play detective work to try to find those triggers and underlying imbalances. But if someone's not willing to follow the foundations, again, they're not going to get optimal benefits, even if we do find, like if we find, let's say, H. pylori, and we think that might be a factor. But if they're eating fast food and refined sugars and unhealthy oils, it's really going to be difficult to recover. So it's really important to get those foundations. But then we also find that a lot of people incorporate the foundations, but that's not enough. And because again, there are a lot of times other factors that they do need to address, like I just mentioned.
Right. So if somebody's not, I know you practice down in North Carolina, if somebody's not local to your practice, are you able to do telehealth?
Yes, I've been actually, even before the pandemic, I've been doing telehealth consultations for quite a long time. So it's obviously a lot of practitioners do it since the pandemic these days. So there are other options too. But yes, I do work with a lot of people remotely.
Okay. And how can people find you?
Well, yes. So thank you. So I also have a podcast called Save My Thyroid. So that's a great way to learn more about me and talk about hyperthyroidism, Hashimoto's on the podcast. I have actually a couple of websites. My main website, Natural Endocrine Solutions, which has been around since 2010. But then when I released the podcast name again is Save My Thyroid, I'm like, SaveMyThyroid.com is a lot easier to remember than NaturalEndocrineSolutions.com, or also spell for people. So I'm like, all right, I'll just have a second website. Not sure if that was the best decision, but so SaveMyThyroid.com is where you could find my podcast. NaturalEndocrineSolutions.com is where you could find my articles and blog posts. Also have a newsletter, Healthy Gut, Healthy Thyroid newsletter, which you could check out by visiting SaveMyThyroid.com/newsletter. And those are some good places to get started.
Yeah, I mean, that sounds like that's so content rich with all types of information so that people can start even making slow changes to their lifestyle that are all going to optimize their endocrine system, their immune system, and of course their thyroid.
Yeah, and I forgot, important too, I wrote 3 books related to thyroid. So two on hyperthyroidism and one on Hashimoto's called Hashimoto's Trigger. So can't believe I almost forgot to mention my book. So my books you could find, of course, on Amazon.
You're a busy guy. I have a book coming out this year, which I'm very excited about, on birth. But it's been a long, I really admire anyone who's published a book, because I'm like, oh my God, this is one of the hardest things I've ever done, and very impressive.
Yeah, well, congratulations on the release of your book. Excited to read that.
Thank you. Dr. Eric, thank you so much for coming on the show today.
Thank you so much, Dr. Laura. Appreciate you having me.
Well, I hope you enjoyed today's episode with Dr. Eric. I think the moral of the story here is that we really need to trust the innate intelligence of our body. And if our body is giving us symptoms and signals of dis-ease and disharmony, then we want to understand why. We want to identify the root cause. We can certainly, as women, look within ourselves, use our intuition to help with that, and then also bring in the expertise of well-trained functional medicine practitioners like Dr. Eric to help navigate and direct us on the path of healing and wellness. If you want to find more about Dr. Eric's work and how you can work with him directly or to get his books, you can go to his website at naturalendocrinesolutions.com.